name is Guy Brissot, and I'm one of the pediatric surgeons here at Sidra, as well as at Hamad General Hospital. And I'm one of the trauma surgeons, and in fact all the general surgeons are trauma surgeons here. And part of our role within pediatric care in Qatar is in fact to provide the pediatric trauma surgical services. So prior to opening Sidra, the vast majority of pediatric services and surgical services in the country of Qatar were done at Hamad General Hospital. As Sidra was opened and we brought out some of the subspecialized services to Sidra, it was only logical that the Sidra trauma program be also brought on. But this cannot be done in isolation. Trauma is a disease that starts from the point that the child is injured. It involves pre-hospital care. It involves hospital care from the entry typically into the trauma room and all the way through the system, the operating room, the intensive care units, the wards, and then on to rehab, with ultimately the goal to get them integrated back into the families and the communities. And really the trauma program looks after all aspects of that to ensure that there's coordinated care for the trauma patients. Otherwise, we only do it in our own little silo. I look after them when they're in the OR and afterwards, but I don't think about them about rehab. The program tries to look at all the parts of how we come together to care for the patient in a comprehensive manner. And it's not just the physicians. It is the incredible nurses that we have that care for the patients at their bedside 24/7. It is the child life specialists which distract children and use play therapy to make sure that they're pain-free and are getting age-appropriate interventions. It is the social workers that's helping with the families. It is occupational therapy and physiotherapy are making sure that the children get back to the most physically active that they can be after their injuries. Not one person can care for the trauma patients, and that's why really it was one of the last programs we brought on board, because all parts of Sidra has to be working at the highest level before we can start bringing on trauma patients. As healthcare providers, we're given the incredible privilege to look after patients in their time of need. And that centers on everything we do at Sidra, as well as the Sidra Trauma Program.